Susan, why are you here today?
Well, I received a diagnosis of Meniere's syndrome or disease late September, early October of 2015. And I guess I wasn't really satisfied with that diagnosis in some sense. I mean, when I left the ENT's office, I was given a sort of a message of, we don't really know what's causing your symptoms, because they had ruled out an auditory neuroma and some autoimmune hearing loss. And when you rule those two things out and you have the symptoms that I had, you're left with a diagnosis of Meniere's. So I was feeling fullness in my ear, my right ear, and that fullness, it's actually been sort of a cascade of symptoms. Like, it started with just the fullness in my ear. Then I was having some hearing distortions. It lasted several weeks. I kept thinking it would go away. It never did.
Mainly on the right side?
Only on the right side.
Okay.
Yeah, only on the right side. And it was only after I experienced being dizzy. I was dizzy but not incapacitated, and it lasted about 20 minutes or so, that I thought, oh, I should probably see somebody about this. And so those were the symptoms that brought me to the ENT. And you know, I saw him, and then 2 weeks later, after I had these other tests done, I received the diagnosis of Meniere's. You know, so I was told to go on a low sodium diet and avoid caffeine and alcohol and stress.
How do you do that?
Yeah, I'm thinking, okay, now I'm really stressed, but I'll try not to be.
Sure.
So I was following those, you know, guidelines, but I didn't really notice any difference in my symptoms. I mean, even, you know, on days when I found it difficult to eat because I was stressed, you know, nothing really changed, and hasn't substantially changed since the diagnosis. I still feel that oral fullness in my ear. I've had some occasional ringing and sort of sensitivity to sound, that kind of thing, sometimes whooshing, sort of a whooshing sound in there. But my ear has never really felt normal since that diagnosis. And so, doing research on the web, I found a connection between people who suffered from TMD and these same symptoms. These ear symptoms overlap with TMD symptoms.
So did you have any kind of imaging done on the inner ear, like an MRI or CT?
I had an MRI done for the purpose of ruling out a neuroma on the auditory nerve,
Okay.
which I didn't have.
You did mention that you had headaches
Yeah.
around the forehead and sinus. Can you, where does that start for you?
It can start several places. Sometimes it just feels like it washes across my face from right to left. It does kind of throb. It feels swollen. It feels just like something is swelling up there. The throbbing is sometimes along my gums too, like just inside my mouth, around my teeth. Sometimes I have this sensation of things moving from the back of my head up over my scalp. There's like this tingling sensation, and you know, then it can sort of center around my forehead and just feel like a constricting band.
You also checked off sore throat with no infection.
That's happened to me often over this is another one of those things that I thought, boy, I feel like I have a little, something coming on, maybe I'm getting something. And nothing. And then it would like sort of appear, and then it goes away. So I always think, oh, okay, I guess it was nothing. But I didn't, that when I saw that, I thought, on the sheet, I thought, oh, that's happened to me. So, you know.
And so, tell me about how your teeth fit together.
They don't fit together in the same way twice, is how it feels in my mouth. I've noticed over many years that it always felt like my right lower molars, my right back teeth came together before the rest of my other teeth. I could just sense that. But it's gotten, this is part of this cascade of symptoms, it's gotten worse over the last couple of weeks. Worse in the sense that now sometimes when I put my teeth together, I feel like my back teeth aren't touching at all and just my canines are touching. Sometimes there's a molar in my lower right hand jaw that just feels like it doesn't belong anywhere. Like I bite down, I think that that tooth has nowhere to go.
I kind of believe, as you believe, that Meniere's disease is an unfortunate diagnosis in the sense that the ENTs have a lot of technology that they use, but there's no way that they can measure the bite like dentists can if they have the right technology in their office. But I absolutely believe that either Meniere's is a subset of TMD or it's a misdiagnosis of TMD, because otherwise what I do would not work for Meniere's patients. Right. It would be similar to you are an insulin dependent diabetic and I'm going to give you antibiotics. Well, the antibiotics work and they're good, but the diagnosis is wrong.
Right.
So until you start getting insulin, then your blood sugar will be regulated and things will go back. And in the literature says that there is definitely, I'm not the only one who's noticed this, but there's a correlation between missed days at work with Meniere's patients and those people getting treatment for their TMD symptoms, and the Meniere's gets better. Right. So I happen to think that those are linked for sure. Yeah. So Susan, we're in 50 minutes into DTR and we have really good scans now. Tell me what you notice is different.
Oh, my bite feels completely different than when I walked in here. Whenever I bit down, whenever I closed my mouth, the first thing I felt was my right jaw, my right teeth coming together. and my bite was very much all in the back of my mouth. And now it's just so even across my mouth. I don't notice that tooth, that lower molar at all.
Where you were banging in.
I was banging against it. I could just, it was always right there. And now everything just comes together so lightly.
You were restricted on both sides.
Yeah.
And you were restricted more on the right side, which is something I see 100% of the time.
Huh.
The restriction in movement is the affected side. Always.
Yeah, okay, interesting.
Always.
Yeah, I mean, it's so, I can't believe the difference. And it was such, every time you worked on my mouth, I thought, well, that can't be doing anything. He's just, you're barely, I mean, I could sense that you were just barely touching the tooth and then coming off and touching it, especially in the front. I thought, that's not going to do anything. What's he doing, you know? And then it's just completely different.
You are, people who are affected adversely by the bite are people who are very, very sensitive in their proprioception. And if it's off just a little bit, so again,
crazy.
Yeah, to reiterate what you just said, we didn't change a lot, but we changed very specific pieces, and some pieces we didn't touch. There are entire teeth in your mouth I absolutely did not touch.
Right. I know.
And without the computer guiding me, I'd be guessing at blue dots.
Right.
I mean, there's no way around that statement.
Yeah.
So, all right.
Amazing.
So, same thing?
Yeah.
Go ahead and swallow.
I felt a little more sensitivity over here. It felt like a 2.
So how is that possible?
I don't
We
know.
took, I'm going to tell you what we did. By removing all of the noxious stimuli, the interferences, we took away all the tooth-on-tooth friction. So now your back teeth separate immediately with canine guidance, anterior guidance. And so there's no friction.
Right.
Well, if there's no friction, the nerves in the teeth are not being continuously stimulated.
Yeah.
So now things that were troublesome are not, like ice water.
Yeah. It seemed like before I sought treatment, things just kept getting worse. The noises in my ear got more severe and louder and less predictable, and the dizziness sort of intensified. And then, you know, once I sought treatment for my TMJ with you, the dizziness, the ear sounds decreased. They were still pretty present, but they were so loud to begin with that I was happy even just with that improvement.
Sure.
I haven't had any vertigo since then. So that's been since, I don't know, a long time.
Okay.
Yeah. I can tell after every adjustment there's some adjusting going on just in my, I can feel muscles sort of reacting to that, especially always on the right-hand side of my face. But those sinus type you know, episodes that would sort of, it felt like just inflammation across my face have really decreased. In fact, I haven't really noticed any in the last couple of weeks, actually. No headaches, yeah.
Good.
Yeah.
inner ear issues, which were really kind of the reason why you sought out treatment with us.
Yeah.
Tell me about ringing in the ears, hissing, buzzing, any of that?
All of that is substantially decreased. I still have some. There's still also, I can just tell that there's some, there's just a little bit of, I don't know what you want to call it. I'll call it fullness. I can tell that my jaw still has some place to move in order to get rid of that, but all of that's substantially decreased. It's still there, but it's also still improving. So I mean,
Sure,
it's even
still
better.
healing.
Right, still better this week than like last week. Do you know what I mean?
Excellent,
So,
absolutely.
yeah.
What about the vertigo, dizziness, and pain in cheek muscles?
I haven't had any of that.
Okay,
Yeah.
good, good. So Susan, do you have any words of advice for anybody who gets diagnosed with Meniere's disease?
Yeah. I think if I were to do it all over again, I would check out these two options right away. Probably would have skipped the trip to New York because they're so obviously connected. It's the TMJ dysfunction and the cervical spine were the two things where I felt immediate relief. You know, it's not completely resolved, but I have high hopes that it will be, just because the improvement has been so steady. You know what I mean?
Sure,
Yeah.
that's fair.
Yeah.
So specifically, the two things you're talking about are disclusion time reduction therapy
Right.
and a NUCA chiropractor.
Right.
And so not everybody does that.
Right, an upper cervical spine trained chiropractor, yeah. There are different, methodologies for adjusting that thing, but you can easily find it online, yeah.
Sure, okay. You glad you had it done?
Oh, God, yeah. Yeah, I'm just so glad I didn't sit there and say, I guess I just have to live with this, because it was horrible.
Yeah, there's nothing like it.
Right, and just your future is suddenly so uncertain, and I mean, it just is a drag. It was just, yeah, I mean, it's not life-threatening, but
It's life-altering.
it's life-altering for sure.
Yeah, quality of life goes down.
Yeah, and it just doesn't make any sense to not try to sort of get to the underlying cause.
Well, thank you for allowing me to, one, share your story and be a part of your journey.
No,
Thank you.
thanks, thank you.